We are honored to have taken care of you and your family during your delivery and postpartum care. Here are a few important instructions and information to help you during your recovery time over the next 6 weeks. You'll also be given handouts of these instructions, so you don't have to worry about taking notes or trying to remember every detail. If you think of questions during the video, please write them down so you can review them with your nurse or care team. You may watch this video as often as you'd like, and there'll be a link in your Riverside MyChart account for reference and access at any time. First, let's talk about the importance of post-birth warning signs. POST is an acronym that represents warning signs that you need to pay special attention to while at home and call 911 if experiencing any of these issues. The P is for pain in your chest. The O is for obstructed breathing or shortness of breath. The S is for seizures. The T is for thoughts of hurting yourself or others. In addition to POST, call your OB provider if any of the following occurs. You soak a pad in an hour or pass a clot bigger than an egg. Any part of your incision is not healing. You had a vaginal delivery and have lacerations that are not healing, are red, or are swollen. Your calf muscles are red, swollen, or tender to the touch. This could be an indicator of a blood clot. You have a fever greater than 100.4. You experience headaches that don't get better with medicine or include a change in vision. There is an increase in pain that is not relieved by medication. You have foul-smelling vaginal discharge. There is pain in your breasts, especially if accompanied by a fever. This can be a sign of mastitis, an infection of the breast. You can still breastfeed, but need evaluation by OB doctor. Please call your OB provider with any questions if something doesn't feel right. If your OB provider is not available, please visit an urgent care or the emergency room. Next, let's talk about activity. Get up and walk daily. It's okay to go up and down stairs if you can do so without pain. Continue with your regular diet. Shower, but do not take a tub bath or use a hot tub or pool until your vaginal bleeding has stopped. Please restrain from driving for 1 week. Do not lift more than 15 pounds for about 4 weeks. Moving on to vaginal care. Do not insert anything into your vagina for 6 weeks, including tampons, douching, or having sexual intercourse. Your uterus is an open wound, and insertion may cause bacteria to grow that can lead to an infection. Continue to use your peri-bottle care until your bleeding completely stops. This helps keep the area clean. For lactation suppression, avoid any type of breast stimulation, as it will only encourage milk production. If feeling engorged, hand express just enough milk to reduce the pressure. Use ice or cold packs to reduce engorgement, swelling, and pain. Take ibuprofen or acetaminophen to help decrease pain and discomfort. Some patients have found that drinking sage or peppermint tea decreases their milk production. It's normal for breasts to continue to produce small amounts of milk for weeks, months, or even longer. Binding breasts is not recommended and can lead to painful plug ducts. Watch for signs of mastitis, which may include fever, body aches, redness, or pain in the breasts. If you experience any symptoms, reach out to your healthcare provider. If you had stitches due to a laceration, they will dissolve on their own, usually within 2 weeks. To manage pain and swelling of your laceration, take a sitz bath 2 to 3 times a day. A sitz bath is a shallow, warm water bath that is taken while you're sitting down. The water should only come up to your hips and should only cover your buttocks. If you have any signs of infection or increased discomfort, please contact your OB doctor. If you had a C-section, it is important for you to care for your incision. Be very gentle with your incision. Don't let your clothes rest on the incision line. To clean your incision, rub gently and pat carefully to dry. No firm rubbing, pulling, or friction. Do not use lotions, oils, perfumes, or anything scented. Make sure you keep your incision dry after your shower. Use a mirror to look at it regularly. During healing, you may have sensations of itching or burning. This is normal. Please contact your provider if you experience any signs of redness, oozing, or increased pain from the incision. Vaginal bleeding will change color from bright red to light pink or brown and can last up to 6 weeks. During that time, you may experience your bleeding tapering off to just spotting. Increased bleeding may be likely during breastfeeding or an increase in activity. If at any time your bleeding becomes heavy, in other words, soaking a pad in an hour, contact your OB provider. If you are breastfeeding, it is not unusual for your periods not to return until breastfeeding has slowed or you have stopped altogether. Please note that it is possible to become pregnant during this time before your regular period returns. Regarding medications and prescriptions, you may receive prescriptions that your OB provider has filled here with us at Riverside or with your preferred pharmacy. If you have questions about your prescriptions, please reach out to your OB provider. If you've been given topical medications for comfort related to your incision, stitches, or hemorrhoids, many of these can also be purchased over the counter. With all medications, remember to take only as prescribed. If you're feeling both happiness and sadness during your first few weeks, this is normal and referred to as baby blues. Feeling sad, being anxious, or even crying is perfectly normal after giving birth. And after a few weeks, you should start to feel a little more yourself. If these feelings continue or increase after the first few weeks, you experience a lot of anxiety or feelings of depression, or you cannot care for yourself or your baby, call your OB provider immediately. Make a follow-up appointment with your OB provider within 6 weeks after discharge, whether you had a vaginal delivery or cesarean delivery. Your nurse or member of your care team will add the time frame for your appointment to your printed discharge instructions. If you had a cesarean section, your provider may want to do an incision check in the office in 1 to 2 weeks. Your provider may also recommend a follow-up appointment in 1 to 2 weeks to make sure you're feeling okay after delivery, or to follow up closely on complications that occurred during your delivery or postpartum experience. You'll receive a printed after-visit summary prior to leaving the facility, and your information and this video will also be available in Riverside MyChart. Thank you for choosing Riverside. We are honored to care for you and your family.